so we'll just do a little reintroduce. My name is Carrie Ann, and I am from Boston, Egoscue, and I am speaking with
Miranda, and I am also a therapist at Egoscue, Boston.
And we have some of our clients and some people with some questions today, and we're going to be talking to you about arthritis because it hurts, but we can help. So we're going to give you a little overview of arthritis and how we can help.
So just going into it, arthritis is quite literally inflammation of a joint. So your joint gets inflamed, it causes pain, it can cause tenderness, it can cause different types of symptoms, but basically arthritis is simply inflammation. So that area is swelling up, not feeling great. And that's what we're talking about today.
Right. And that's just super general. There are lots of different kinds of arthritis, and they kind of fall into two categories. For the most part, there's the wear and tear arthritis, which is osteoarthritis, and that happens with post-traumatic stress or overuse of a joint or just general wear and tear. And then there are the autoimmune types. The most known is rheumatoid arthritis, but also lupus is in that category. And there are many different kinds and little subcategories that sort of fall into place, but for today, we're going to be mainly talking about those two types of arthritis and sort of breaking it down a little bit, and then talking about how we can help and answering questions that you have about it. So I think we're going to start with osteoarthritis. Whoops. All right. So quite simply, it's a breakdown of the joint cartilage. And what happens is it can actually change the bone shape. Just like all arthritis, it causes swelling, pain, and stiffness. There are 4 phases. So osteoarthritis is sort of catch it at the beginning and stop it before it continues. And that is why it's so important. As soon as you start getting that stiffness, that inflammation, as soon as you think maybe it's coming, just to get on top of it, to not use I have, arthritis, so I'm going to lay off. That's not the best way to move forward. The best way to move forward is to get on top of it and correct it, because it doesn't go away, but it can be stopped in its tracks. There are risk factors. Most people as they age do get some form of osteoarthritis. It can come from injury. And then if you are overweight, you are more likely to have it. And so I have the knee picture up here, and the knee is often one of the spots where we get osteoarthritis. 6 times your body weight is put into your knees every step you take. So that's a lot of weight. So the more excess weight you have, the worse it feels. And so if you look at the pictures, we have sort of the healthy knee, and then this is osteoarthritis, and this is probably like a stage 2 osteoarthritis knee. So when I was thinking about this, I remembered that 80s commercial for drugs. That this is your brain on drugs. This is your bone or your condyle, and this is your arthritic bone or condyle with the little bumpies. And so, yeah, sorry, I know my picture is small, but this is healthy. This is a healthy bone ending. The condyle is just the word for the end of your bone. Should be smooth, and it has cartilage over the top. It also has synovial fluid, which is like Vaseline that goes over the cartilage. And these things help to shield your bones from touching each other. They're like a lubricant, so your bones will glide. It's basically your femur bone, this big leg bone, and then it meets your tibia bone. Your fibula meets on the side as well, but basically this one is showing your tibia. And then there's also cartilage on top of your patella, which is the kneecap that goes on top. So those are 3 different points where your body has where your body has the sort of opportunity to get out of alignment. And so I just want to go over all of us are born nice, healthy knees, and this kind of little stuff here just glides it. We're walking, we're staying in alignment, and it moves nice and smoothly. Nothing happens. Over here, the first thing to happen is this little white stuff starts to thin a little bit. And really it's called the wear and tear arthritis, but what it is the misaligned wear and tear, because you don't automatically get arthritis from moving. That just isn't what happens. You get it from moving out of alignment. It's a disease of poor biomechanics. Basically, when something gets out of alignment, maybe something is pulling this kneecap and your knee starts tilting to the side. So we'll say it started tilting to the side here, and this cartilage started to thin. So what happens? Your body wants to fix it, and the immune response is to send all these fixing proteins and this fixing energy there. And then all these little osteophytes, which are basically bone spurs, start to form. And that's just your body's way of trying to repair it. It says, oh, the bone is touching, let me go and fix the bone. So it's trying to fix an area, but what happens is now this is no longer, it has a bump and it can no longer smoothly glide. If you take that and you go like that, it's bumpy. And so the only way to help that, to keep that from happening more, is to realign that and create space. The cartilage isn't going to go back, but we can create space by pulling this side up and separating the two. And that is what Egoscue likes to do for people with osteoarthritis or arthritis that comes after an injury, because it doesn't always happen as we age. It happens, my daughter broke her ankle a couple of times. Why? Because she didn't have strong enough ankles, because she didn't listen to her mom. And she is at risk for getting arthritis. She's starting to get those clicks and that stiffness. She is 13 years old. And so we have to get on top of it before it progresses any further. So this is something that we can stop in its tracks and take the pain away from. And then Miranda is going to cover the other kind, the autoimmune types of arthritis.
Yeah, so autoimmune, meaning the main difference between rheumatoid arthritis and things that fall under that category versus osteoarthritis or wear and tear is that it is actually your immune system. So the inflammation is actually your immune system causing inflammation. The idea is that your immune system is almost attacking its own cells. And typically, like rheumatoid arthritis, so first of all, there's no age barrier with that. That can start as young or as old. But this typically starts with the smaller joints, whereas typically like osteoarthritis or wear and tear typically starts with the major load joints, the joints that you're using the most to like carry your weight. So typically it starts with like the fingers, the toes, maybe the wrists, but it can, if you don't take care of it initially, it can progress to larger joints. So think of like the hips, the knees, etc. So with this, it is more of an immune response as opposed to just your body breaking down. But again, the goal and what we're going to talk about more is if we can get the body into a better position, it can at least help reduce those types of symptoms. But it is quite a bit different there because it is like, again, an immune response. The body is kind of automatically just trying to attack something in there. That's the biggest difference. But again, it's kind of if you look at the photo, it's a similar mechanism in regards to like there is an inflammation around the joint, which can cause like the pain and the discomfort and like the same symptoms.
And what happens is it's the same idea that your body is it's trying to fix itself. Okay, even though it causes that initial damage, it's then sending more fluid to try and pump and get rid of the attacking cells, but it all just collects and pools, and it can be really painful to move it. So people just want to stop moving, but then everything is stuck in one spot.
Yeah. So that being said, going from, the different types of arthritis and what we spoke about, I just want to talk about a little bit like of some of the traditional methods of care. So typically the traditional route to go, which I'm not saying is a bad route, but it is, an option, is to go for different types of medications, whether that be an over-the-counter anti-inflammatory, like a Tylenol or an Advil, to reduce the pain, reduce the inflammation. There are creams and ointments to help reduce aching. There are also prescription-based modifying drugs, you could call them, that help slow down the immune response for rheumatoid specifically, but that will not do anything for osteo, of course. And then the option for both rheumatoid and osteo are also oral or injected corticosteroids. So steroid injections in order to help reduce the swelling and slow the immune response if it is rheumatoid or autoimmune based. So again, those are all very common and helpful traditional treatments that can help at least reduce the symptoms and the pain and the swelling.
Right. But those are Band-Aids, and they take away just the symptom. And they don't do anything to sort of change it long term. And it also wears off, especially the more cortisone shots you get. Your body actually starts to deteriorate that joint and that bone even more. So that, although it makes you feel good on the short term, on the long term, it just degenerates your bones more quickly. And then, of course, alternative treatments, which I am a big proponent for. I do not believe that if you're doing Egoscue, or if whatever you're doing, whatever type of treatment you're doing, it is not one or the other. I think you should do everything that you can. And I commend all of you for being here, because if you're here, whether you're already doing Egoscue or you just searched us, you're looking for alternative methods. You're looking for ways to help yourself already. And good for you. Why wouldn't you? And we all can do so much. Diet. There are tons of anti-inflammatory things you can do. You want to, get rid of the nightshades. You want to increase the leafy greens. You want to increase turmeric. You want to take out all the things that hurt you. And also, again, weight loss does play into raising or lowering your pain here. Acupuncture can be helpful. Massage, one of the best ways to get things moving, not hard, but is just gentle massage, especially when there is a buildup of fluid around a joint. You want to move that fluid away from the joint. You want the blood to just do its job and feed and nourish that joint, that bone, that cartilage. So you have to get sort of bad blood away, good blood in. And now CBD is everywhere, and that has been effective. I think do your research for all alternative treatments, and they all have benefits for sure. And so this question is one when people with arthritis ask a lot, is should I stop moving? Sometimes the doctors will tell them to stop moving. I had somebody, their doctor said, you can never lunge again. Well, then what happens to that knee? Then you never use the muscle around your knee, right? Sure. Do you need to stop jumping on a misaligned joint in that moment? Yes. If you're very out of whack and you're jumping and you're just pounding and you're just hitting bone on bone, yes, you need to stop that, and you need to stop that immediately. But do you need to stop moving? Absolutely not. You want to retrain your biomechanics. That's the way you want to treat arthritis. All whether you do the traditional method, which does include traditional PT as well, or you follow a more alternative. You want to reduce the inflammation, retrain the muscles, and retrain your biometrics. That's how you're going to get rid of the pain. And that's how you're going to treat yourself. And so how do you do that? You need to strengthen the muscles around the joint, strengthen the muscles in other areas. I mean, if your knee is weak, you might have to work your glutes. I think we have the muscles of the knee, right? Joint next, Miranda. Can we?
Yeah.
Also, increasing strength increases bone density, which is true. So these muscles, if you never did a lunge again, or you never took a step again because you had arthritis in your knee, your quadriceps, your hamstrings, all of those muscles are going to atrophy. And then what's going to happen is you can see that these muscles are attached to this kneecap, right? And that kneecap was one of the 3 connection points. So if this kneecap gets all loosey-goosey and it just slides around, there's just going to be more rubbing, more wear and tear, more bone spurs, more osteophytes to that area. And it's just going to get worse and worse. So stopping all movement, stopping all exercise is not the answer. It can't be the answer. Because it's just that will inevitably increase your pain and make your symptoms flare up even more.
And that brings us right to proper alignment. So again, we need to make sure that we're strengthening those muscles that are supporting the joint, make sure we're getting that joint into the proper alignment, making sure that the muscles surrounding that joint or the bones in general have the strength to support it in order to help it move properly and not put that, continue that pressure. So again, less pressure equals less pain, proper movement in the joint. So again, what Carrie-Ann was already kind of touching on, getting that proper movement. Obviously if you're jumping on something that doesn't want to be putting pressure on, like that's not going to fly, but making sure that you don't just say, well, I have arthritis and I'm going to sit down and just be like that for the rest of my life. Like that's just going to make it worse. Want to make sure that we're giving the joints the support that we need, improve the strength, improve the function to reduce the pain. And I guess that's kind of where we go into Egoscue.
And so I think many of you are familiar with Egoscue, but we are a form of postural therapy based on restoring the body's integrity, balance, and symmetry. Okay, and that's a means to eliminating chronic pain and increasing function, because everything in balance works better, feels better, runs better. Even your car, your tires are out, your body is the same exact thing.
So what we do with our therapy is, we're making sure that we are assessing your posture properly. We're making sure that based on each individual's posture, whatever the symptom is, whatever you're coming in for, what the main goal is to get your body into proper alignment to help reduce pain, reduce swelling, reduce symptom, reduce pressure, all of these things. And again, it's all personalized. So we're making sure to look at each individual's, your movement, your function, what you're capable of, how your body's looking, all of those things, in order to help provide you with the right thing, that way.
And what we call that is your menu. So those of you that are clients already, we design your menu. And so how do we do that? If we go to the next slide, and this is going to be a repeat for basically all of your appointments, but this is our functional man. This is, in an ideal world, your 8 load joints are going to be aligned, right? Shoulders, hips, knees, and ankles, top to bottom, left to right. If you've had photos done with us in a session before, then you've seen yours popped into the grid. And to a trained or untrained eye, it is easy once you get those lines, once you see, it is easy to see where those misalignments are right off the bat. And so step number 1 in our process is looking. We look at your low joints, we see where you're off. Step number 2 is watching you move. If you see Miranda or Matt or I or Mike or whoever you see, we just watch you move. And that's where our eyes come in a little bit more. And we're watching which way you're going. Which way do you pull your knee up? Which way do you shrug your shoulder or touch your toes? What happens to your hips? That tells us what muscles in your body might be short and what muscles in your body might be long. And why does that matter for when you're treating arthritis, right? So if you have supple muscles, everything moves nicely. But if you have maybe this outside muscle short and this an inside muscle long, it's going to be off center. You're going to be off kilter. And then what's going to happen? You're going to get a bone spur. So we look and we see, okay, we need to lengthen that muscle. We need to strengthen that muscle. We're going to find the dysfunctional area in your body, because it might not be your knee. It might not be your ankle. It might not be the area that has that arthritis now. It might be coming from somewhere else. And we're going to design something tailored to you to retrain those muscles, to recreate space so that even if we've already got the bumpy ball, it no longer touches. And that is essentially how the menu is going to treat the arthritis. And that's when you guys come into play, because once we work on the menu, you have to go home and do your homework. And I think one of the biggest parts of the menu of the first time you do it, the second time you do it, is coming back and giving us the information and telling us what hurts. A lot of people who are in pain don't want to complain. Maybe you like your therapist, you don't want to bother them, you don't want to make them feel bad that they didn't, that you didn't feel all better right away. That's not a thing. What it is it's information. What happens to your body when you do something is how we help fix it. That's how we help create your menu. So your feedback is really important to us, and we need to hear what you're saying. And that is something that happens at Egoscue that doesn't happen in a lot of traditional PT. And that's really what can make the difference. And like I said before, you've already taken the first step to be an advocate for yourself, and you need to continue that throughout the process. And then, so people ask if it works, and Miranda, do you want to go back to that one about the Stanford study and go over that?
Yeah. So, going off of just, the personal feeling, if we're going to look at just how often it works, it is known as of right now that 94% of clients feel better after going through the system or going through the method. There was actually a study done through Stanford, Harvard, and it did show a 41% reduction, particularly in low back pain, and a 62% decrease in disability after 4 visits. So think about that. That's only, if you're first starting, about 4 weeks of going through the menu, going through the process. And this is very, recent information as well. So,
it was done over 4 years, and it was compared to traditional PT and or just the use of drugs and or Egoscue. So that was the study. And so I sort of went over how important creating that relationship with your therapist is. And that is one of the points that really sets us apart from the sort of traditional physical therapy or the traditional treatment. And that, again, is not to say not to do that. I think you need to do everything that you possibly can to help yourself. You need to listen to your doctor. You need to go to regular PT if they say go to regular PT. I think you absolutely need to follow an anti-inflammatory diet if you're already suffering from arthritis. But you need to ask questions, and you can ask us anything. You can bounce ideas off of us. If anybody has questions specific to Egoscue, specific to arthritis, anything right now, I would like to open up the floor to all of you to go ahead and ask us.
Actually, it looks like there is already a question. Let me pull it back up. So we're looking at what is a good golf or tennis exercise routine, like what to do before, during, and after. And then also questions about the tower, which conditions it's. So we've got some good questions already.
Okay.
Yeah.
Good.
Well, I would say for golf and tennis, there are definitely some, patterns that we're looking for with those sports with almost every client, because it's, the same types of movements. But, that being said, it's still going to be based on your own personal evaluation of how your body's moving.
So, sorry, we see that, Thank you.
Hi, Kathy. Thank you. I'm sorry. So, but that being said, like there is a such thing as like having a separate, menu to do, you have your everyday menu and having like certain menus to allow you to perform certain activities better, more efficiently, and more functionally. I don't know if you have anything to add to that, Carrie Ann.
Yeah, I mean, honestly, the premise of Egoscue is that it's very individualized to you. But you're here and you're listening, and I'm gonna say golf is a sport of rotation. So if your body's rotation is off in some way, shape, or form, then you need to fix that. One of the best ways to fix rotation is counter rotation. So Jillian, I don't know if you can unmute yourself. Are you a current client now, or are you somebody who's maybe looking at the book for exercises? Or you can type your answer. Just so I know if I throw out names, if you know the names that I'm talking about. Okay, well, I will give an example of an exercise in case you're still there that I really like to give to golfers. And this, again, not everybody's the same, but if you are somebody who is already a client, then I will say this is one of my favorites, and I don't really have myself set up for, but this is so a standing wall twist is one of my favorite counter rotations, and it hits all the spots for golfers. You would stand next to your wall, just about a foot away, and you would take your outside foot, step it heel in front of toe, twist to put your hands even with your shoulders, and look over the other shoulder, and you will just look as far as you can at the same time, squeezing your scapula back and down. And why that's good for golfers is because you need to have loose hips, you need to be able to follow through, you need to be able to pivot. So that's one thing that can help do all of those things with you. I also really love that one if you're stuffy, if you suffer from allergies. Turning your cervical spine that much helps to drain your sinuses. So that's just a little tip there. Is she there? Do we answer the tower question? Is she not there anymore? I don't know.
Don't see anything in the chat.
So yeah, the tower is almost like a whole separate ball of wax. But I will say that sort of to give a broad answer to that question, the tower is targeting your psoas and hip flexors. And so it's a piece of equipment that was designed by Pete Egoscue and by a number of therapists together that helps to change the length tension, which is all we do in Egoscue. We're always changing length tension in your body. That one is more specifically devoted to the psoas and the hip flexor. And it can be really, really helpful if you have, your discs are misaligned, or you're a runner and you have I mean, there's any number of things that it can be helpful for. And spondylolisthesis. There's a number of conditions, but it is mostly targeted at the psoas. Okay. Good. Does anybody else have any other questions? All right. Well, if we are all shy about asking questions, and you have questions that you maybe don't want to talk about in front of everybody, then that's fine. You can either message us and leave your phone number, or you can just email boston@egoscue.com. But you can always reach out, and you can just search at egoscue.com, and something will pop up, and you can call. You can call our number. I'll just say our number. I have to read it because all of these years and I don't have it memorized. 617-916-5331. But always ask. That's what we're here for. So I think I want to thank you guys for lending us your time, for listening. And for those of you that are clients, I want to thank you for working on yourselves, because it's one of the most beautiful things you can do in the world.
Absolutely. Yeah. Thank you guys so much. Thank you for coming. Thanks for listening. And I hope this was very helpful.